Hi everyone, how's it going today? So we are chatting about the idea of feeling like you are more like a technician and not so much a clinician. So you are, feeling like your work is kind of a bit repetitive and monotonous. You're just kind of doing the same thing all the time. And when I say technician, almost like this feeling of I could have just trained to do this thing, like the thing that I'm repeating all the time. I could have just trained to do that instead of like having all this knowledge and all this expertise, and feeling like it doesn't really get used in your day-to-day life as a clinician. So that's what we're chatting about today. I'd love to know from you guys how you feel about this, what your experience is with this, and maybe give us a number, like how, if you had a scale that was on the one side a 1, which is completely feeling like a technician, feeling that monotony, that repetitiveness, feeling very narrow in what you're doing all the time, to like a 10 being all the way to clinician, right? Like feeling like you use all that knowledge and expertise, you are using a lot of different information from different sources to make a decision. You are treating a patient completely differently based on different characteristics. And so what you're doing from one patient to another changes a lot. And you have a lot more variety. Your brain is very stimulated. And yeah, all that knowledge and experience is kind of being used. So I'd love to know on that scale of like 1 completely technician to 10 completely clinician, where you're kind of feeling like you are on that. So you guys can just pop a number into the comments, and I'll just go back and kind of ask you a little bit more about it, and yeah, just get some more detail on this. Sorry, I think there's a dog barking that you might be able to hear. Okay, awesome. So for those of you who don't know me, I'm Sarah, health and career coach for clinicians. And so this is one of the areas that I love to work with clinicians on, is this feeling of that their work is kind of boring or monotonous or repetitive, and often very sort of like cookie cutter, looks a lot like everybody else, right? How do I, as a clinician, not only like develop my own philosophy and beliefs and approach to care that I really kind of stand behind, and kind of stand out from other clinicians, but just as an experience for myself, like how does that experience of being more like a clinician at my job lead to more fulfillment, more satisfaction, feeling like you're actually making more of an impact on someone's life. So yeah, those are all things that can come into career coaching, and then also in the range of kind of more health side of things, if we are, just completely overworked, and that often happens when we are in that more kind of technician role. We can feel very bored out, but we can also feel very burnt out. So often it can lead to stress, it can lead to being unfulfilled, and it can lead to, just questioning a lot of things within our career. So this is one of the topics I love speaking on. So I'd love to know as we go and kind of what your thoughts are on it, your experiences with it, and we'll get into some of the topics around this today. And if you're joining live, give us a wave. It's always nice to see who's joining us. And if you are watching the replay, you can just hashtag replay with any of the ratings or comments or anything that you'd like to contribute to that. Awesome. Okay, cool. So I wanted to start off with just a bit of my own story with this. So it kind of differed at different parts of my career. I think at the sort of more early on periods, it was more just kind of feeling like I was kind of molding myself to what I thought in my case, a chiropractor should look like, right? Or should be like how our treatment should look. And I sort of just took that default and sort of copied it in my practice, and then just felt like I was kind of, just going through the motions. So for me, it was more that in the earlier stages, and then later on, when it was more kind of high volume, lots of patients, shorter treatment times, it felt more kind of, I didn't feel like I had the energy to really be a clinician in the true sense of that I felt that I could be, because of that kind of exhaustion at so many patients and that shorter treatment time. Like, you almost then want to become more efficient and you want to save energy. And so part of what we can start doing when we have that is that we start to repeat things and they start to be more monotonous. And we'll go into this a little bit more because obviously there's trade-offs to all of these, right? That has its benefits as well. And it's also not only bad, right? When a practice has high volume, short treatment times, one of the priorities there is we want to help as many people as possible, which is a legitimate desire, right? And it can be very helpful to fit as many people as possible and to be able to help as many people as possible. But I think sometimes, and this can be sometimes a particular personality, sometimes just being in that space for a while, but sometimes you start to want a sort of deeper approach, but less patients, which also has trade-offs, right? Because then you're helping less people, but you're helping them in a deeper way. So that was it for me. I often felt kind of bored and felt like things were very monotonous, but also didn't really know how to like kind of break out of that. And yeah, I think for a lot of clinicians that is a similar experience, and I'll go into some of the reasons why. But I think the main reasons are that idea of like really high volume, short treatment times, right? We have to then prioritize efficiency, getting things done on time, and not expending so much energy, mental and physical, for every single patient, when we know we have, so many to go. So there's the high volume, short treatment time. There's also this idea of like being hyper specialized. And I think in medicine and healthcare, we do this a lot. So we really, really specialize in like a very narrow thing. And this is where clinicians, and this is mainly sort of chiropractors that will express it in this way, but this is common amongst all clinicians, just it presents in different ways. But let's say for chiropractors, it feels like it's very specialized to the technique, right? So manipulation, and that is it, right? You're doing some form of that, whether that's mobilization, actual manipulation, or maybe you do like a little bit of soft tissue and maybe an exercise or two as homework, whatever, but that's the focus is that very specific technique, right? And you can imagine why that starts to feel quite monotonous and boring, because we're doing essentially the same treatment for every single patient, regardless of what they come in with. And of course, we're still doing history, we're still doing diagnostics, but I've often heard from clinicians that they almost like they won't develop their skills in those areas because their sense is like, well, I end up doing the same thing anyway, so it just ends up, it's more like, I just want to be safe. That's the reason that I'm doing those things. I just want to make sure that I'm being safe. But beyond that, like it's not like if I learn this small nuance to diagnostics, right? It's like if it's a lateral disc herniation, I don't treat it differently to a central disc herniation, for example, right? So then people will often kind of ignore those or not develop themselves in that direction because their sense is, well, it's not going to make that much of a difference to how I'm treating. And then it becomes a bit of a self-reinforcing thing, right? And then also what happens is like, a clinician mentioned this as well, is like because we're doing the same thing like quite repetitively, we're not using so much of the other knowledge that we slowly start to lose it, right? If we're not engaging that part, if we're not repeating and using those skills and that knowledge on a consistent basis, we are going to lose that. So then we don't even try to incorporate it because like we kind of think, you know, I don't even actually remember it, or like I wouldn't know how to do that confidently anyway. So again, it starts to kind of self-reinforce. And I think the other way that it kind of becomes a self-reinforcing thing is that the patient then expects the same thing. So I was having this discussion with a clinician where she said she has to adjust because the patient expects that. And then that becomes self-reinforcing, right? Because if everyone is adjusting because their perception is that the person expects that, guess what the patient is going to expect, right? At some point, we have to break that. And this is not to say that you don't communicate that expectation ahead of time, right? Like we don't want to completely do something that's different to a normal session that someone would expect in our career and not say anything to that person and set expectations. We can be aware of the fact that, you know, this person might have gone to other chiropractors or other clinicians and they may have come to expect a certain thing, but I can communicate what they can expect from our interaction, right? So you can warn the patients or, like, you know, set the expectation beforehand, but just noticing how that becomes just a loop. If you're doing something just because the patient will expect you to do that, the patient is going to keep expecting that. That hyper-specialization is one of the big reasons. There was also the study of surgeons who specialize in a certain surgical procedure for the knee. And then in research studies that were shown to be not any more effective than a kind of sham operation procedure. But even after that research came out, many of these surgeons kept on doing that same procedure, right? Partly because, you know, it feels like, well, to me it seems like it works, right? Because that's the sense that we get. When, you know, it's our patient, the patient is getting better, we struggle to really accept wider research on, like, actually it's about the same as placebo, right? So that's part of it. But then also, if you have invested all this time and energy and resources getting specialized in a particular technique or procedure, how easily are you going to let go of that, right? So that kind of sunk cost fallacy where you keep going in that direction because you've already put in so many resources and time and all of that into that direction. So just realizing the pitfalls of being so specialized in a particular technique or method is we really struggle when there's research to show that that's maybe not the most appropriate or the most helpful for that particular patient. We will still be doing the same thing because that's what we've been trained to do. And then the other thing that it can sometimes be, and this is where I mentioned about personality, but it can also be interests, values, etc. But some kind of mismatch between the person and either the career or the practice that they're working at, right? So for example, I really love helping patients make lifestyle changes. I get really excited about, you know, like them making changes that are outside my practice room. But in a certain kind of practice environment, that is very much de-emphasized, and the kind of physical treatment, the adjustment, is very emphasized. So for me, that wouldn't be a very good match in terms of work environment. Whereas if there was another work environment where I was seeing just a few patients a day, I had a lot of time with them, I could go into all that kind of stuff, I might feel less like my work is repetitive or boring because I value certain aspects of that interaction more. Whereas if someone is, like, for example, in this scenario, if you're a chiropractor and adjustments are genuinely what you find so exciting and you love adding like nuance to that and finding different ways to do it, and then that isn't going to feel as monotonous, even if that's what you're doing all day, because you value it, you feel like it's exciting to you. That's where you feel like you can make the biggest difference for people. So there's often kind of a mismatch issue rather than the work itself, if that makes sense. So I'd love to hear from you guys as well, if you feel kind of like it's a career thing, or if it's like a specific to your workplace. And then also, like, Some people are just more, they want more variety in their day. Right? Like some people are okay with, they call this like an I-shaped career, right? You go really deep in one area, versus like a T-shape where you have in depth in one area, but then you have a lot of like general knowledge and expertise. And so you can kind of draw from a wide range of things in order to see that person in front of you. Whereas when you specialize in only one thing, you kind of, you know, focus on that particular thing. And some people really love that. They love deep diving into something. They love being super specialized and knowing everything about a particular topic, or a particular technique or whatever it is. Whereas for other people, they'd much rather have that range, that variety, their day looking different from one day to another, their patient to patient looking very different from one patient to another, right? So some people crave that more than others, and that's an important thing to know about yourself as well. I think just to note, like generally in our society, people will value and make you feel like you should be kind of hyper specialized, and that's kind of the good way to be. And a lot of the like success stories is like, you know, people that from a young age wanted to do this thing, and then they practiced and they became an expert in that, and they just, you know, like their career took off because they were so focused on that one thing. But there's so much research to show that the typical path is not that. The typical path is like sampling a whole bunch of different things, even in the sports world, right? Sports men and women sampling different types of sports before then later specializing into their sport, rather than like from the beginning. So I think just in general, a lot of clinicians want variety. They want to do different things. Sometimes they want to do something for a few years and then move on to something else. And I think just generally having that idea that that is not something inherently bad. That might just be you as a clinician. That is what lights you up, and that is what you're good at. You're good at having a very like wide view of things. This is how I experience it as well. Like I love to have a lot of variety in my day, in my life. I love to do different things, and I love to like draw on different fields, like, you know, looking at psychology, looking at neuroscience, looking at behavior change, you know, the arts. How does that all like integrate to help the person in front of me? So that to me is so exciting, where like things come together and they integrate and they fuse. Whereas for some people that just feels like, you know, chaotic, and they would rather just you know, focus on one thing and get really good at that and focus on that. So sometimes it's just that mismatch between the clinician and the workplace. Okay, so what can we sort of start doing in terms of how can we change this if it is something that we want to change, right? So that's where I first want to just touch on is like for some people, they might realize like, actually, I'm okay with my work being a little bit repetitive, right? Like maybe it's, you know, it for some people, their career doesn't form that big a part of their life that they would worry about that. They're like, okay, yes, sometimes it gets a little bit monotonous or boring, but I'm not there for very long. I have a very kind of flexible work schedule, so it's not like the majority of my life, and it's not where I get, you know, the majority of like my meaning and fulfillment and all of that. So I don't mind that. Whereas for other people, that might be completely different, right? It might be feel very urgent to have more variety and to not feel monotonous and to feel like you really are fulfilled and excited about what you do and all of that. So that's also just another reminder that it's totally okay if you do feel a little bit like it's monotonous, but you don't mind that much, and it's not that big of a deal to you. It is totally okay to just have it be a little bit monotonous and repetitive, right? That's totally okay if that's what you are comfortable with. So that's the one thing. And then realizing that, and this is part of like maybe you decide at the end of this process that you're actually fine with it, because we want to look at the trade-offs, right? And I mentioned a few of those earlier on, right? Like maybe if your priority is helping as many people as possible, you're going to prioritize squeezing as many people into a day as possible, which is going to mean high volume and short treatment time, right? Which only gives you that much room to play with how much you can then be a clinician in that space. And the clinician, I mean, obviously we're all clinicians, even if we're doing that. I just mean in this kind of framework of more towards technician versus clinician, you're most likely going to feel more towards a technician than a clinician, right? And so there are ways to counteract those trade-offs, which I'll chat about in a second. But let's just accept first that there are trade-offs. We can't have everything. We can't have as many patients booked as possible and have like as much variety as we possibly can, right? Those things are going to balance out, and we need to decide like, what are we prioritizing, and then as much as we can try and mold around that. But there might be certain things that we are kind of sacrificing for the sake of the thing that we are prioritizing, right? And for other people, it might be if you are prioritizing spending a lot of time with each patient so that you have the brain energy and the time to kind of really dive deep into like diagnostics and the nuances and have a completely different treatment for every single patient instead of the same treatment. If that's what you're prioritizing, you might then compromise on how many patients you can help, right? How many people you can fit into your day. And again, you might kind of compensate for that in various ways. But generally, if you're prioritizing that, you know, that's going to be the focus. So I'm trying to think if there's any sort of other examples of trade-offs. But yeah, again, so let's say something like hyper-specialization, right? If you are hyper-specializing in one area, there's trade-offs to that, right? There's good things about that. You're going to learn so much about that specific thing, and you'll really be able to help patients who have that particular thing, or that particular type of patient, or whatever the thing is that you're kind of specializing in, or you'll get really good at that technique or method. But there's trade-offs in terms of like the range and the variety and freedom, and you know, if anything is slightly outside of that narrow focus, that you maybe can't then help someone, right? So the first thing is just accepting the idea of trade-offs and noticing like which trade-offs are actually being made in the situation that I'm in. And I'd love to hear from you guys as well in the comments. What does it feel like the practice that you work at, right? Whether that's your own practice or someone else's practice, what feels like the thing that's being prioritized? What is front and center? Is that helping as many people as possible, or you know, fitting as many patients in as possible, or having efficiency, right? Like if you think about every patient technically would need a different amount of time, but that's very difficult for us to plan and be efficient in and have systems around. Like we can't be like, well, we'll see how long it takes, right? We need to know like what is our treatment time, what is the price for that, etc. So just realizing like what trade-offs we're making in the name of efficiency or volume or you know, financial gain, whatever it is, right? And then there's the acceptance of the trade-offs, and then there's also room to kind of compensate in some way for that trade-off, right? Like for example, if you are seeing less patients in a day, maybe you increase your prices so that you're actually not making less money because of that, right? Like if I'm going to spend this much time with you, to me, my prices need to be higher than someone who's going to spend half of that time with you. So that could be a way to kind of compensate for that trade-off, let's say. Another example could be if your treatment time is very short, you could support the patient in other ways that are maybe less time intensive. Like maybe there's a you know, a program that you can use where you can send them exercises, or they can log habits, they can track their habits on a particular, there's coaching apps that you can use for that. So ways that you can support your patients outside of that. And another way that I've seen clinicians compensate in some way for this short treatment time is that they are with the patient for quite a short period of time, but the patient is at the practice for much longer than that. So they will have, for example, this example again from my field, but let's say I am with a patient for 15 minutes or 20 minutes, right? And then, but before they come to me, they are having a massage, right? And then they come to me, and they'd say after that they are getting dry needling, or they are going to a room where they're getting trained with certain exercises, right? So you can have the total treatment time longer, but the time that they're seeing you can still be shorter. So that's also another way to kind of get around that, right? So where can you kind of compensate for whatever you're losing out on, but just realizing that certain trade-offs are going to come with certain compromises, and you have to decide for yourself which things you're going to prioritize, which things you're okay to compromise on, which things you're not okay to compromise on. And if you decide, I actually want to make certain changes, whether that's, small changes, like this is one of the ways that we can start taking steps. We can start just taking baby steps, right? Like you can notice, okay, I seem to always do this particular treatment, right? This method. Maybe you just take something small that you can slightly adjust to be slightly different for each patient. And then you build on that, right? Like maybe I can add a few minutes where I am giving an exercise just to have something different in the treatment time, right? So you can kind of build with small steps, and that might be for your situation the most ideal option. Like you don't just suddenly make a complete huge change to the way that you treat or consult with patients, but you're just taking really small steps and you're building on that. And then the other way that it can happen is sometimes we just decide that we want a big change, right? And that can be a career change, that can be, leaving your job and going to another job. It can be leaving your job and starting your own thing. There can be so many like huge shifts that people make, but sometimes that is what happens, that people just realize, no, this is not it for me. And I think especially it can be so helpful when you are making a big change to really get super clear on like, what is it about this situation that I don't like? What is it that I would want different? What is it that I believe, right? What is my philosophy? What are my beliefs and my approaches to care, or my desired approaches to care, right? Before you make that big leap, so that you know what direction you're going in, instead of, just saying, well, this isn't it. I don't know what is, but this isn't it, right? One of my coaches used to put this as, we want to be running towards our lover and not running away from a bear. So we don't want to just be trying to escape the discomfort and the monotony and the boredom and whatever that we're experiencing. We want to be going towards something that feels really nourishing and that lights us up. So deciding on what that is can be a really helpful step, so that we're moving towards that and that we're clear on that. Awesome. So I hope you found that helpful. There was, again, a lot in this, and we can always go more in depth on one of these things. But I think it's a really important thing, because I just find, if I think about how long clinicians study for, how many different areas of knowledge that we have, how many patients that we've seen, and that knowledge and that experience that we've accumulated, to me it's like such a pity that essentially gets wasted when our work is so monotonous and repetitive, and it feels like you're not even really using your brain. Like to me it feels like such a pity that happens, and I don't think that it has to happen, or I know that it doesn't have to be that way, right? But I think often we just get so we just see the kind of default, and this is how people do things, this is how people practice, and we, similar to what I was doing, right, in my career, I just sort of copy and pasted what other people were doing, and then couldn't understand why I wasn't feeling fulfilled, and like I had variety and stuff like that, but I had never designed my career around what I really enjoyed and what my interests were, what my strengths were, what type of personality I have. So it makes total sense that that wasn't fulfilling for me. It's for another person, the exact same career or practice or job or whatever could have been incredibly fulfilling and like lights them up so much. But for me, that wasn't the case. So yeah, I think that it would be so amazing if clinicians could just like use all of that, not only for their patients, because I think it would be hugely beneficial to patients if we were really utilizing all of that knowledge and skill, but also for ourselves, to actually have that fulfilling and impactful career that we could have. So yeah, that really excites me. But yeah, I would love to work with you if this is something that you feel like you want support on. As I said, this is part of what I help clinicians with, creating that really clear belief system, that clear like philosophy approach, and then often making changes that need to happen, whether that's those small incremental changes or whether that's big life changes. And I love supporting clinicians through all of that. So send me a DM if that is something that you are interested in, and we can talk about what it would look like, what it would entail to work together. Awesome. Thanks so much, guys, and I will chat to you guys next week. Bye.